Hi, I'm Tana Tamaki, a CareerFoundry student, and today I will be talking about how to prepare for influenza season in the United States. Since the flu is an annual public health emergency, this is a time when additional medical personnel are in high demand, and many clinics and hospitals end up being insufficiently staffed to treat patients, particularly patients who are more vulnerable and who can develop serious complications, which often results in hospitalization or even death. So, to proactively plan for staffing needs across the country, this project analyzes historical data from 2009 to 2017 and identifies who makes up this population or this vulnerable population and which states should be prioritized to help determine when and where to effectively send staff across the country. And here are some visuals just for a quick overview and to give you a relative idea of how the flu impacts the United States differently. So every year we can see from 2009 to 2017, flu deaths were over 40,000 across all of the United States. And this is a map of flu deaths per capita, just to give you an idea of how the flu impacts the states differently, with darker states representing more flu deaths per capita. And you'll actually see this map a little later, so I'll get into more detail about this later. So, first, we want to know who is most at risk during flu season, and here are a couple of visualizations that shows the flu disproportionately affects adults 65 years and over, with this age group also reporting more total flu deaths compared to the rest of the population. The rest of the population being those under 65 years old. And in the bar chart, you can see that for adults 65 and over, the number of flu deaths in this age group accounted for over 90% of the flu deaths for the entire country, while the rest of the population accounted for about 8%. And you can see kind of how stark this contrast is every year, where 65 and over adults are disproportionately affected. Moving on to where to send staff, flu deaths by region was analyzed, along with mapping flu deaths of vulnerable individuals. So now we know those 65 and older are most vulnerable to the flu. Going back to the map you saw earlier, you can see it's again the flu deaths per capita, but now we can also see where these vulnerable individuals are. And based on these, if you see these blue circles here, we can see where the most vulnerable populations are in the different states. So the larger and darker the blue circles are, the more deaths of those 65 and over. And we can see that states like California, Texas, and Florida had the highest flu deaths for those 65 and over. And you can already tell just by looking at the map that the southern part of the country had high flu deaths per capita, because you can see a lot of the states here are darker, but we can also tell from the line graph that this actually is true, and that the South did consistently account for the highest number of flu deaths compared to all the other regions like the Midwest, Northeast, and the western parts of the country. And in particular, the top three states with the highest flu deaths per capita were Tennessee, New York, and Hawaii. As you can see, they're quite dark, meaning more flu deaths per capita. Okay, so now we know who is most at risk and where the high risk areas are. The last important detail to note is when flu season actually occurs. And if you look at the graph of seasonal flu deaths by region, these are actually the same regions you just saw in the last slide. the flu impacted each region differently, but we can see that in all of the regions, flu deaths were the highest in the winter. So here's the winter. You can see it's the highest in the Midwest, Northeast, South in particular, and again high in the West. So it affected them all differently, but flu deaths were the highest overall in the winter. And looking at a monthly breakdown, you can start to see the timing of when flu cases start to appear in the States and that they actually peak at certain times during the year. So you can see in September, flu cases start to rise and then they keep rising quite intensely from December all the way through February and have a final peak during March, which again kind of backs up what I just said here, which is more flu deaths are in the winter, and we can see specifically during the months of December, January, and February that flu deaths are actually the highest. So, in summary, we now know that adults 65 and over are the most vulnerable population during flu season. The southern part of the US has the most flu deaths per capita. And if we're looking at which states to target specifically, that would be Tennessee, New York, and Hawaii, who had the highest flu deaths per capita, as well as the states of California, Florida, and Texas, all of which contain high numbers of flu deaths for those 65 and over. And since medical staffing agencies can anticipate an increased need for medical personnel during the winter, they can also anticipate that cases could begin as early as September and last until March, and should specifically pay attention to the months of December through February having the most flu deaths for the year. And lastly, in terms of next steps, since we know who the most vulnerable population is, we could apply a targeted approach to care for these individuals in order to decrease their flu deaths and improve their patient outcomes. So we could try to improve preventative measures like flu shots. We could reach out to these older individuals, go to them, maybe go to their places of work, have transportable clinics, and just try to reach them more so that we can make the flu vaccine more accessible and hopefully decrease flu deaths overall. And finally, real-time monitoring of flu cases and patient outcomes could be tracked to see if our recommendations were successful and to make sure that clinics and hospitals aren't under or overstaffed in states across the country. So with that, that's all I have for today. I hope this presentation provided useful insights on how to effectively plan and prepare for sending medical staff across the US during flu season, and I thank you for your time.